Well, there are now more than 300 measles cases in the U.S., and that is more than the total number of cases reported all of last year and 5 times as many as 2023. The CDC says 95% of the infections are in unvaccinated people, and most of them are in Texas and New Mexico. At least 15 states now have confirmed cases, and 3 of those states, New Mexico, Oklahoma, and Kansas, of course, border Colorado. So late this afternoon, I called Dr. Michelle Barron, the Senior Medical Director of Infection Prevention and Control for UCHealth, and Dr. Barron says it is time for us to start paying attention.
Should we just go ahead and assume it's not if, but when Colorado does see measles?
Yes, I think it is a matter of time.
And what do you want people to know?
That if you're unvaccinated, that you are at a higher risk of developing complications from measles if you're exposed. And there's still a good opportunity to get your vaccinations, even though you may have not received them in the past.
So a couple things just of sort of practical things. Do adults need boosters?
It's a great question. So if you have got 2 vaccines, then you're considered immune and you don't need to have any more. If you only got 1 vaccine, and there's a group of people between probably 1970 to about 1983, 84, who probably only got 1 vaccine because that's what the standard was at the time, then you probably need a second vaccine.
Okay, so how do you know if you got one or any when you were a child? Well, actually, your doctor can do a simple blood test that will tell you. And Dr. Barron adds that a second vaccine injected, even if turns out you don't need it, it will do you no harm. And if you had measles as a child, you are immune, and your insurance should cover the cost of the vaccine.